Life and Wellness in Elizabethton, Tennessee, and I'm Dr. Denise Sammons. I'm a naturopathic doctor, and I'm here today with my friend Charlene McGough. Charlene came to me, it's been, I don't know, about 6 months ago, and she came with fibromyalgia. Her pain levels were at a 9 or a 10. She was in severe pain. She had severe gut issues. She was actually burping about 40 times a day. She had mobility issues. She could not walk in and come up our steps. She had to come up the handicap ramp. She could not lift her legs. Tell me about how your legs felt when you first started coming here.
Well, when I first started coming, and up until really just recently and doing all the therapies and taking the supplements here, I felt like that my legs were just encased in concrete, and it was just very difficult to even walk in the house from the bedroom to the kitchen or in the house, and it was very difficult to go up steps without just pulling myself up.
Yeah, I can remember when you walked in here, and I would see you come in, from the parking lot. You were almost shuffling when you walked. It was I've teased you just a little earlier and said she was doing the Tim Conway shuffle, but you also had high levels of anxiety when you started,
yes.
severe anxiety, and you were dealing with a lot of numbness, tingling. You had shooting pains in your legs. Any other symptoms that you want to tell us about? Oh, your carotid. Tell me about that, because you had medical testing done on that.
Yes, I have a lot of heart disease in the family, and in the past I have had some heart issues and had a heart attack at 10 years ago, actually, almost, and so I kept a close check on that, and I had a test on the carotid artery about 3 years ago, I think, 3 or 4 years ago, and it showed that it was actually climbing, hitting almost the 60% mark. And I recently had that rechecked, and I got a call saying it was absolutely normal. So that was a huge weight off, and a great testimonial, that this works.
Yeah. Okay. So what she's dealing with now? We did energetic testing, which you guys know we do. We use Zytotechnology here, and we were energetically testing her. We found a lot of Lyme bacteria and the co-infections of Lyme, some parasites. She also had high levels of mercury in her body because she still had some amalgam fillings. And if you know anything about anxiety, one of the neurotransmitter in the brain that controls anxiety, that's the calming neurotransmitter, is GABA. And GABA cannot be made when there's mercury, because mercury blocks the conversion of glutamate to GABA. So she was having severe anxiety. So one of the things that we did is referred her to a mercury-free dentist, had those amalgams removed.
Yes.
We started chelating her very, very slowly. And so during this whole process, we've worked on chelation, we've worked on parasite cleanses, we put her on some proteolytic enzymes, and that's what's actually cleared out the plaque in the arteries. We've had that testimony many times, and that's been medically documented by people that have even done heart caths that have come in before and after. And we have that medically documented. So there are a lot of neat things you can do to reduce plaque in the arteries without going on statins. And actually, statin drugs are what triggered your leg conditions. Is that right?
It is. I've been on. I tried to humor the doctors in their words, just humor me, and go on the statin drug. And I was very innocent about that in the beginning, not really realizing the dangers of it for some people, and some people seem to tolerate it better than others, but that doesn't always mean that it's a good thing to do, because they can be, as I understand it, so very toxic in many ways. But I have taken 5 different statin drugs, and each time they affected my legs. They felt just kind of like jello, and it was but this last time, that I had a really nice cardiologist and just a very caring doctor, and he said that they had come out with one that most people could tolerate, would I just try it? And I did, and it really did more damage than any others that I've taken, and that's when I developed this severe mobility issue of walking, and then my legs feeling encased, with concrete, and the burping and the swelling of the legs twice the size, and the ankles. It really was just grueling to go through. And I gained 30 pounds in 4 months, and it's been very difficult to get that off.
Well,
so
when you're in pain and when you can't walk and you can't move, then you're going to have the weight gain. And then also the other thing that comes from that is your lymphatic system gets congested because you can't move, and movement is what helps the lymphatic system to flow. So she had a severely congested lymphatic system. The other therapy that we started with her was the assisted lymphatic therapy, and then we would always follow it with ionic foot detox. And just since she's been doing the lymphatic therapy, you've seen amazing changes
it's made
with that.
A world of difference. It really has. And my husband and I both, he's been very concerned. I've been concerned because I have worked so aggressively trying to get well and not knowing what the issues were. And when I came to Denise and she did, the scan that she can do, exactly what you're dealing with. There's no guesswork to it. It's very precise, and even down to the suggested supplements. I've been really impressed with the fine art, that it is, and it's certainly not child's play, and it's certainly has made a huge difference in my health, and I'm just really grateful. I'm not 100% yet. It is a work in progress here, but we are making great strides, and that gives you hope. And when you have hope, you can move forward, and it gives you courage, to do the things that to do. So I'm really grateful to you and what you do here.
Well, I'm so blessed to be a part of all this, and your legs, your varicose veins. She was even telling us today she's seen a reduction in that and the swelling, and then the overall swelling of her legs, and just her ability to be able to walk and just to be able to do that without pain. And her husband seeing a difference. When you have a lifestyle that you've had to make changes in what you're able to do, and just come out of the house and be able to work in be in a social setting, and that was totally interfering with your life.
It radically changes your life. And I used to be very active, very involved with a lot of community work and fundraisers, and it pretty much has kept me not homebound, but the mobility has just been so challenged that I did not do a whole lot outside the home. So I had to bring people and women to me just to keep contacts with people. So
we've seen just an awesome change in Charlene, and all that she came to us, all of the health issues. She just was a severe case, and now you can see her. She's standing up. She's walking. She doesn't do the Tim Conway shuffle anymore.
Even.
She's smiling. She doesn't have anxiety. You've made some amazing changes and progress, and she's been consistent, and she's followed her protocols, and that's a big part of it.
Yes,
is there anything else you'd like to say?
Just that I'm really grateful, to have found you. It's
You've been through a lot of practitioners, haven't you?
I have. I've been through.
Some of them gave up on you. You told me when you came here, they said you were their worst case, and they didn't know what else to do.
I did that program for 2 years, and I may have a little bit of result with some of it, but nothing like this has done. This is just no comparison.
Yeah.
And I thank you for giving me hope. I thank you for being the Christian woman that you are, and praying with me, and then, like I said, it just gives one hope. Yeah. And if you don't have hope, you don't have anything, because you just give up on life. And I just thank you for giving me my life back.
Oh, thank you. Thank you. All right. Thanks for joining us.